Correlation of infant mortality and income levels, Afghanistan and Japan compared with an infographic. Introduction. Infant mortality is defined as death of young children under age 1. This is a very big public health issue of global interest due to the global burden of disease and pertinent maternal and child health issues. This problem also has a significant economic component that immensely affects outcomes. And this basically talks about countries with significant high expenditure on health per capita that have seen tremendous improvement in infant mortality. An example is Japan, which is in the global income group of high income level, and as evident here, there has been a reduction from 30 per thousand live births in 1960 to most recent mortality rates of 2 per thousand live births. Afghanistan, on the other hand, is in the global income group that is very low income levels, and low socioeconomic status. For this reason and many other factors, it's had some reduction since the 1960s. At the time, it was 246 per thousand live birth. Currently, most recently, from data from 2016, it is 53 per thousand live births. This is to say that the country's expenditure on health is dependent on the country's income levels. As I said earlier, per capita income that is invested into the health of the country, reflecting the mortality rates. This is the influence diagram that we're going to look at right now. It has the relationship that exists among the stakeholders in Afghanistan and Japan. Basically, I have Japan here in this little square here, and it's showing the infant mortality rates per thousand live birth to be 2. It's showing the income level being high here. On the other hand, for Afghanistan, we have 53.2 mortality per thousand live birth, and the income level is low. Some of these stakeholders are the Ministry of Public Health, Kabul in Afghanistan, the Director of Health Economic and Strategic Planning is one of the stakeholders. Ministry of Education, we have the WHO, and then the World Bank that feeds the data, that has the data from Afghanistan. The relationship is both ways, going to the Public Health Department or the Department of Ministry of Health of Afghanistan, and then the WHO. WHO helps with socioeconomic issues, education, birth control, and means and ways to help reduce the mortality rates. We look over here to Japan. We have all the good things that is going on over there, whatever they've done to help reduce mortality rates to 2. The Director of International Economic Relations is in Japan, Director General for Statistics and Information Policy, that helps to get some of these data. And the Ministry of Health, Labor and Welfare, there's also the WHO and World Bank having a relationship with Japan. Japan's significant reduction to mortality rate of 2 per thousand live birth. And also we have advocacy groups that are involved as stakeholders, and these people essentially help at this point, because we're not really looking at the mortality rates of Afghanistan and just comparing it to Japan, but in this influence diagram, we also looking at ways to help reduce the mortality rates in Afghanistan. By doing so, bodies like the NGO and then media, social media, can help to spread the information that will be looked at later on in this presentation, spread the information to the Ministry of Health of Afghanistan so that they can do all they can, along with the bodies like WHO, World Bank, to help to tailor all the good things that is going on here. It's not only economic factors, but also factors such as nutrition and the healthcare system of Japan. Since Japan has a very high statistic, or a very good statistic for infant mortality rates, it is very imperative that such an influence diagram, having all stakeholders together, have some form of correlation, some form of partnership there and collaboration that can help to make a significant impact. We're going to go ahead and look at the infographic for showing the correlation of the infant mortality and income levels between Afghanistan and Japan. I have narrowed it here so that we can see as it is as an infographic. And now let's expand it so that we can see what is on here. As mentioned earlier, Afghanistan has a low income level. There's low per capita government health spending, and Japan has a very high income level. So it's got already the government puts a lot of money per capita into health spending, and this helps a lot in reducing mortality rates for reasons such as access to care and so on. Let's look at this graph here. In the development of this infographic, there is some research that was done, and as we see here, for Afghanistan, we can see that the factor that we just talked about right here, the point of per capita spending of the government and how it reflects in infant mortality, we can see here in blue. The blue here is the per capita spending, and then the red is the infant mortality. As we can see here, it is very low, and it reflects inversely on the infant mortality rate. Comparing this to a country such as Maldives over here, they did put a lot of money into the health sector by the government. Per capita spending and it is very reflective here as we see an infant mortality rate at a very low. Comparatively, we look over here and we see Japan is over here, and it's also talking about GDP or expenditure and also the infant mortality rates. Comparing to a country like Kenya here, it is very high. The infant mortality rate runs from 0, goes all the way to 190, and then the GDP, the expenditure, also runs from 0 to 50,000. And we can see over here Japan is all the way up here between 30 and 40,000. And as we can see, if we map it to the infant mortality rate, it is very low. It is very low, under 10, as it's shown here. As we know, theoretically it is 2. Actually, it is 2. So that is the significant impact over there between the expenditure or income levels and infant mortality. 2016, the most recent data that was used from the dataset that was adapted from the World Bank for this presentation. 2016 has 53 deaths per 1,000 live births, and that is the infant mortality rate. This has been improved from 1960's value of 246 per 1,000 live births. Even as it stands here at 53, compared to this, we see there's a significant improvement, but it's still very high for a country if we compare that to Japan, which is 2 per 1,000 live births. And of course, Japan has also improved from 30 per 1,000 live births since 1960. Solution: to look at the problem in Afghanistan after comparing the income levels and also making a direct comparison to Japan, a country with significant and better statistics for infant mortality. The suggestion here is that there has to be improvement in socioeconomic determinants of health and also access to health by all Afghan populations, which helps a long way to help reduce the problem of infant mortality. Advocacy efforts to the Afghan government to increase per capita spending on health. As we said earlier in the influence diagram, we do have advocacy groups in the influence diagram. Let's look at it real quick over here. Advocacy groups that links between the Japan and then the Afghanistan government. So essentially, we are talking about efforts that tailor the success strategies of Japan and then implementing those in Afghanistan. Another important suggestion or contribution is to ensure that there is a collaborative partnership that is fostered amongst the stakeholders of this problem. Now to dissemination idea. The influence diagram as well as the infographic presented in this presentation can be shared or disseminated at conferences, also can be sent out to the Ministry of Health of Afghanistan, and also through social media or new media, and through advocacy groups as talked about earlier, to help to advocate for this problem or this issue of infant mortality. In the long run, all efforts that are made towards reduction of infant mortality will go a long way to reduce this problem. And if that is reduced for Afghanistan, it will go a long way to reduce the global impact as well.